Hi, my name's Hannah. I'm going to be your nurse today, and I'm here to do your head to neck assessment. I provided privacy. I washed my hands. I checked the chart. Can I just see your wristband? Can you tell your name?
Kyle Smith.
And your date of birth?
12/3/99.
Great. What brings you in today, Kyle?
Yearly checkup.
Great. Are you in any pain right now?
Mm-mm.
If you're feeling any pain at any point during this assessment, just please let me know.
Mm-hmm.
Do you know who the president is?
Donald Trump.
Okay. What is today's date?
The 15th of October, 2019.
Do you know where you are?
Up here in Michigan.
Okay, great. The patient is alert and oriented ×3. I'm now just going to ask you some subjective questions regarding your head. Do you have any history of head or neck surgery, any injuries, any neck pain or limitation, any lumps or swelling? Are you experiencing any dizziness? Okay. Any headaches frequent? Okay, great. I'm now just going to inspect you and feel your head. I'm just going to be feeling for any lesions, masses, lumps present. Okay, are you feeling any pain or tenderness? Okay, great. The size and shape are symmetrical. The hair is evenly distributed. The patient denies of any pain or tenderness. I'm now going to feel for your temporal artery. The temporal pulse is equally bilateral at a +2. I'm now going to perform a few tests to assess for cranial nerve number 5. Can you open and close your mouth for me? Just again, please. Okay. No cracking or popping present. Now with your eyes closed, I'm going to touch a Q-tip to your face, and you're going to tell me if you feel sharp, dull, or soft in the location.
Sharp left eyebrow. Sharp right chin. Dull right eyebrow. Dull left cheek.
Cranial nerve number 5 is intact. The face appears symmetrical. The patient is expressing appropriate action with no involuntary actions. There's no facial abnormalities or facial droops present. I'm now going to assess for cranial nerve number 7. Can you frown for me? Smile. Puff your cheeks. Raise your eyebrows. Droop your eyebrows. Okay, cranial nerve number 7 is intact. I'm now going to just inspect and feel for your neck appears symmetrical. Can you move your head up and down for me? Side to side. Any pain or tenderness? Okay, great. I'm now going to assess cranial nerve 11. So I'm going to just put my hand on your cheek and resist it. Okay, you're going to do the same thing on the other side. All right, and then just the same thing with the shoulders. Okay, great. So cranial nerve number 11 is intact. The patient does not show any signs of weakness while doing so. I'm now going to feel for your lymph nodes now. The pre-auricular, post-auricular, the occipital, the tonsillar, the submandibular, the submental, the posterior cervical. Just go ahead and turn the side. The superficial cervical, the deep cervical. And then we got the supraclavicular. Oh, I say it wrong. The patient does not show any signs of pain or tenderness while feeling the lymph nodes. If the lymph nodes are not supposed to be felt, if they're felt, it could be an infection, and we would conduct a further assessment. I'm now going to just check the patient. The patient's skin is retracting in appropriate time. I'm now going to just ask you some subjective questions regarding your nose. Have you had any surgery or trauma to your nose? Have you been experiencing any nasal discharge? Any colds, upper respiratory infections occurring? Any sinus pain? Any pressure? Any frequent nosebleeds been occurring? Have you been encountering any allergies recently? Any altered smell? Not smelling as well? Okay, great. I'm now just going to inspect your nose. The internal nose, there's no deformities. Nasal spectrum and turbinates are normal in color and size. I'm now going to just have you cover one side of your nostrils and blow, and then just do the other side for me. Okay, great. The patient's patency is normal. I'm now going to just palpate the sinus area, the frontal, the maximal. Okay, great. I'm now going to assess for cranial nerve number 1. I'm just going to have you close your eyes for me and just tell me what you smell underneath your nose.
Vanilla.
Okay, great. Cranial nerve 1 is intact. Okay. Now I'm just going to ask some subjective questions regarding your mouth and throat. Do you have any sores or lesions you've been noticing? Okay. Have you been experiencing any bleeding gums? Any sore throats? Any frequent toothaches? Any frequent horsiness been happening? Any altered taste? Do you smoke or drink?
Nope.
Do you have your tonsils still? Okay. Do you visit the dentist frequently?
Yeah.
Good. I'm now just going to inspect your mouth and throat. Can I just go ahead and have you open your mouth for me? The lips do not appear dry or cracked. The patient's teeth are intact. There's no blood or discharge on the gum. The tongue is normal and pink. Can I just have you say light, tight, dynamite for me?
Light, tight, dynamite.
Okay, great. When these patient states these 3 words, I'm testing for cranial nerve number 12. I'm now just going to have you open your mouth and say ah for me. I'm checking for the soft palate and uveal rise. Okay. Which is number 9, which is not intact. The patient does not have tonsils, but if he did, I would assess the size and color of them and document it. When testing cranial nerve number 10, I would test gag reflex with tongue depressor, but I'm not going to do that. I'm just going to simply just have you swallow for me. Okay, great. Cranial nerve number 10 is intact. I'm now just going to ask you some subjective questions regarding to your ears. Do you have any, your ears, any history of earaches? Any history of okay. Any discharge been happening? Any ringing, buzzing been occurring? Do you clean your ears frequently? Okay, great. I'm now just going to go ahead and look both sides of your ear. There's no drainage or edema. The size and shape are equal. There's no swelling. The ears appear symmetrical with the lateral canus. The ear color is the same as the skin color. I'm going to just go ahead and do the push-pull test. Do you feel any tenderness when I do that? Okay. The patient denies any tenderness. Well, I'm going to assess cranial nerve number 8 now. I'm just going to have you go ahead and stand up for me and close your eyes. Okay, great. Now just go ahead and turn around. All right, I'm just going to go ahead and whisper something in both sides of your ears, and you're just going to tell me the location and what side. I meant and what I'm saying. I'm sorry.
Baseballs, right? Softball, left.
Okay, great. Cranial nerve number 8 is intact. I'm now just going to move on and ask some subjective questions regarding to your eyes. Do you have any history of visual difficulty seeing? Okay, great. Any pain, discharge? Okay, great. Are you experiencing any redness or swelling? Okay. Do you wear glasses or lenses? Okay. Do you go to the eye doctor regularly? Okay, great. I'm now just going to inspect your eyes and just go ahead and take a look. Okay, so your eyebrows and eyelashes, your eyelashes and eyebrows are evenly distributed. The hair, there's no ptosis. And the eyes, it's equal. The conjunctive is clear and the sclera is white. And it appears with normal limitation. I'm now just going to assess your pupil size and make sure that they're equal. Both of them are at a +3. I'm now just going to check for your light, direct, and consensual. Now I'm just going to check for accommodation. So you're just going to look at my pen light and you're just going to follow it. Great. And now I'm just going to, I checked by also having the patient do the Snelling chart, which resulted in a 20/20 vision. I'm now just going to do the 6 cardinal phases. So just go ahead and follow my pen light. Cranial nerve number 3, 4, and 6 is tested by those tests, which is all intact. I'm now just going to do a quick review of the cranial nerves. Cranial nerve number 1 was tested with the vanilla perfume and also by checking the patency in each nostril. Cranial nerve number 2 was tested by the Snelling chart. Cranial nerve number 3, 4, 6 make the eyes do tricks, and this was checked by accommodation, pupil response to direct and consensual, and the 6 cardinal phases. For cranial nerve number 5, I tested by the opening and closing of the TMJ and the sharp and dull test. For cranial nerve number 7, I tested by the puff your cheeks, smile, frown, droop your eyes, etc. Cranial nerve number 8, I tested by the balance test and the whisper test. Cranial nerve number 9, I tested by the opening and closing, opening the mouth and saying ah. And then cranial nerve number 10, I tested by gag reflex with the tongue depressor, which I didn't do, but I did ask the patient to swallow for me instead. Cranial nerve number 11, I tested by showing resistance, which I tested by showing it on the cheek and the shoulders. And cranial nerve number 12, I tested by saying light, tight, dynamite. All right, Kyle, so that finishes up our assessment. Did you have any further questions for me that you wanted to do? Okay, well, I'll let your doctor know, and he'll be in here to further up any other concerns he may have. I hope you have a great rest of your day. Thank you.